Hello everyone and welcome to Life Tips and Ideas. Today I will give you tips for what to expect when you getting COVID-19 vaccine. So let me begin to tell you. COVID-19 coronavirus is a highly infectious disease which can cause serious illness, hospitalisation and even death. COVID-19 vaccines offer protection from COVID-19. If you do catch COVID-19 after vaccination, you should be protected from the serious illness the virus can sometimes cause. Getting vaccinated against COVID-19 is not mandatory, but is strongly recommended that you get your vaccine when it's offered to you. People who are most at risk from COVID-19 will be vaccinated first. There's no charge for getting your COVID-19 vaccine. It's free. You cannot get it privately. The aim in offering COVID-19 vaccines to the population is to protect people and reduce the illness and deaths caused by this virus. People in these groups are currently being vaccinated for COVID-19. People aged 65 years and older who live in long-term care facilities. Frontline healthcare workers. People aged 85 and older. COVID-19 vaccination will be offered to the next groups as soon as possible. If you live in a long-term care facility, you will be offered your vaccine there. If you are a healthcare worker, you will be offered your vaccine where you work or in a vaccination clinic. If you are aged 85 or older, your GP will contact you when your vaccine is available. Do not get your COVID-19 vaccine if you have had a severe allergic reaction to any of the ingredients in the vaccine, including polyethylene glycol, found in the Pfizer-BioNTech and Moderna vaccines, or polysorbate 80. Found in the AstraZeneca vaccine. The vaccinator will ask you about any allergies you may have had a severe allergic reaction to a previous dose of the vaccine. Currently have COVID-19 or symptoms of COVID-19. Wait until it has been 4 weeks since you first noticed symptoms or you first tested positive. Have symptoms of COVID-19. Self-isolate, stay in your room, and phone your GP to get tested. Have a fever temperature of 38 degrees Celsius or above. Wait until you feel better. If you have had an immediate allergic reaction to any other vaccine or injectable therapy, you should talk to your doctor before getting your COVID-19 vaccine. Your COVID-19 vaccine appointments. You will get your COVID-19 vaccine as an injection in your upper arm. It will only take a few minutes. You will need 2 doses. Your second dose will be at least 84 days, 12 full weeks after your first dose if you get the AstraZeneca vaccine. 28 days, 4 full weeks after your first dose if you get the Moderna vaccine. 21 to 28 days, 3 to 4 weeks after your first dose if you get the Pfizer-BioNTech vaccine. Your vaccinator. The person who gives you your vaccine is called a vaccinator. They are a trained healthcare professional like a nurse, doctor or pharmacist. Your vaccinator will answer any questions you may have. They will also give you an aftercare advice leaflet and a vaccine record card. Your record will show the name and batch number of the vaccine you get. If you are pregnant or breastfeeding, there's no evidence that COVID-19 vaccination is unsafe if you're pregnant. There is also no known reason to avoid breastfeeding if you are vaccinated. The vaccines were not widely tested on pregnant or breastfeeding women, so the evidence available at this time is limited. If you are a healthcare worker or at high risk and you are pregnant, you should talk to your obstetrician or GP about getting your COVID-19 vaccine. Read more about COVID-19 vaccines and pregnancy doing your research online. If you have already had COVID-19. If you have already had COVID-19, you still need to get vaccinated. This is because you could become infected with the virus again. There's a small chance you might still get COVID-19 even if you have been vaccinated. But you'll be protected from the serious illness the virus can sometimes cause. Close contacts of COVID-19. You can still get your COVID-19 vaccine if you are a close contact of someone who tested positive for COVID-19, as long as you do not have symptoms of COVID-19 yourself. You should make the vaccination team aware of the fact that you are close contact of a positive case of COVID-19 when you arrive. If you are cocooning and get your COVID-19 vaccine, there is no change in advice. For example, you are still advised to stay at home as much as possible and work from home. If you are not able to work from home, talk to your employer. If you take immunosuppressive medicines, you should still get your COVID-19 vaccine if you take immunosuppressant medicines. Examples of immunosuppressants are steroids, biologic agents, methotrexate, azathioprine. If you take rituximab, speak to your consultant before getting the vaccine. They will tell you the best time between doses of rituximab to get the vaccine. If you have a weakened immune system, your COVID-19 vaccine may not work as well for you. But there is no extra risk in getting it. Consent. You will need to give your consent before you get your COVID-19 vaccine. Your vaccinator will be happy to answer any questions you have at your appointment. Always seek medical advice from certified medical professionals. Thank you all for watching. Please don't forget to like and subscribe for more life tips and ideas. I'll see you all next time.